The femur, or thigh bone, is the longest and strongest bone of the roughly 206 bones in the human body. The femur is a single bone located in the thigh and is superior to the tibia and fibula. Based on its shape, the femur is classified as a long bone. The two rounded ends of the femur, or epiphyses, are covered with articular cartilage, and the diaphysis of the bone, which was once filled with red marrow at birth, will eventually be replaced by yellow marrow. The epiphyseal plate, also known as the growth plate, is made up of hyaline cartilage and is located at each end of the femur. Once a person has stopped growing, the epiphyseal plate becomes the epiphyseal line.
Learning the landmarks of the bone can help aid in understanding the structural role the femur plays in the skeletal system. At the medial, proximal end of the femur is a large, round mass called the head. In the center of the head lies a pit called the fovea capitis. The fovea capitis is the location of a ligament attachment securing the femur to the pelvic girdle.
The head of the femur articulates with the acetabulum of the pelvic girdle, forming the hip joint.
Slightly inferior to the head is the greater trochanter. A trochanter is a bony protuberance which serves as a site for muscle attachment. Separating the greater trochanter from the head is the neck of the femur. Inferior to the greater trochanter is the lesser trochanter. The greater and lesser trochanter are easily distinguishable because there is a clear difference in size, and the lesser trochanter is inferior. Separating the greater trochanter from the lesser trochanter is the intertrochanteric crest. Inter meaning between, and trochanteric referring to the trochanters. Working downwards towards the distal end of the bone on the posterior or back side of the femur is a ridge called the gluteal tuberosity, which continues anteriorly as the linea aspera. Linea aspera is Latin for rough line, and the gluteal tuberosity is the point of attachment of the gluteus maximus muscle. On the distal end of the femur is the patellar surface.
The patellar surface is where the patella articulates with the femur and the tibia to form the knee joint.
Distal end on the posterior side. There are two condyles and two epicondyles. The epicondyle, the lateral condyle, the medial condyle, and the medial epicondyle. A condyle is a rounded knob that forms articulations with other bones. The medial condyle is the largest because it bears the brunt of the load from the weight of the body. The intercondylar fossa is a depression between the lateral condyle and the medial condyle that serves as a point of attachment for two interior ligaments of the knee joint.
The anterior cruciate ligament and the posterior cruciate ligament. It is important to know these landmarks because many leg muscles originate and/or insert themselves on the femur bone and aid in movements such as extension, flexion, and abduction. Amazingly, the femur is capable of lifting or supporting nearly 30 times its own weight and volume. It aids in walking, running, jumping, and based on its size can tell you a lot about a person. The femur alone makes up 1/4 of a person's height. This information can especially be useful for archaeologists who work to unearth and identify hundreds of skeletal remains every year. As we age, our bones progressively decrease in mass, causing them to become weak and brittle. Brittle bones are easily fractured or broken, and this disorder is called osteoporosis. One of the most common fractures due to osteoporosis is a hip fracture, which, based on age, can be a very serious injury. More times than not, hip fractures will require surgery or even hip replacement, followed by intense physical therapy. Seen here in this X-ray, the neck of the femur is fractured. A hip fracture is classified as a fracture of the head or neck of the femur, sometimes even as far down as the lesser trochanter. This video was brought to you by a student fulfilling requirements for human anatomy at Saddleback College.